Welcome to Healthy Community, Wealthy Community. This is Nurse Cephas coming to you with another educational and informative video. Today's Mental Health Monday is about obsessive compulsive personality disorder, or OCPD. What is OCPD? OCPD is a mental health condition where people are overly focused on perfectionism, organization, and control. They have strict ways of doing things and find it hard to compromise. Unlike OCD, where people are aware of their behaviors, those with OCPD often don't realize their actions are problematic. Symptoms of OCPD: preoccupation with rules, details, and order. Perfectionism that hinders task completion. Excessive dedication to work at the expense of personal life. Extreme caution to avoid mistakes. Rigidity and stubbornness. Difficulty working with others unless they do things exactly as they want. Trouble discarding worthless items. Overfixation on flaws in others. Examples of behaviors: micromanaging, constantly checking and rechecking work done by others to ensure it meets their standards. Hoarding, keeping old receipts, broken tools, or useless items because they might be needed in the future. Over planning, spending excessive time planning and organizing tasks to avoid any possible mistakes. It's time for a change. Understanding obsessive compulsive personality disorder. Let's delve in. OCPD usually starts in late teens or early 20s. It's more common in those with anxiety, mood disorders, or substance use issues. People with OCPD might seem confident and organized, but their need for control often strains relationships. For example, imagine a spouse who insists on maintaining a rigid schedule and expects their partner to follow it precisely. They might criticize even small deviations, like not arranging the dishes a certain way or missing a scheduled task, which can lead their partner to feel frustrated and undervalued. Over time, this constant pressure to meet impossible standards can create a sense of distance, making it difficult for their partner to feel truly comfortable or appreciated in the relationship. Diagnosis and treatment. Diagnosing OCPD can be tricky, as people often don't seek help for the disorder itself, but for related issues like anxiety or depression. Mental health professionals diagnose OCPD through detailed questions about behavior and history. Treatment options. Psychotherapy, also known as talk therapy, helps uncover fears and motivations behind behaviors. It teaches healthier ways to relate to others. Cognitive behavioral therapy, or CBT, focuses on changing negative thought patterns and behaviors. One effective therapy used in cognitive behavioral therapy for obsessive compulsive personality disorder is exposure and response prevention. In exposure and response prevention, individuals are gradually exposed to situations that trigger their compulsive need for control or perfection, while being guided to resist their usual responses. For example, a person with obsessive compulsive personality disorder might feel the need to organize their desk perfectly before starting any work. During an exposure and response prevention session, the therapist may encourage them to work on a project with items purposefully left out of place, resisting the urge to reorganize. This helps them to experience discomfort, acknowledge it, and learn that their work and self-worth are not tied to absolute order. Over time, they can learn to tolerate less control and become more flexible in their daily life. While no medication treats OCPD directly, medications for anxiety or depression can help manage symptoms. The importance of addressing OCPD cannot be overstated. Untreated OCPD can lead to poor relationships, job difficulties, and social challenges. Seeking help early can reduce these issues and improve quality of life. Dealing with OCPD requires patience and understanding with those who have the condition. It's important to encourage them to seek professional help. Support them in finding healthy ways to cope with their need for control. As a final note, remember that OCPD is a mental health condition that can significantly impact lives. Understanding and empathy are crucial. Encourage those affected to seek help and support them on their journey to better mental health. To those with obsessive compulsive personality disorder, remember, not everything in life is meant to be controlled. By trying to manage every detail, you may be adding unnecessary stress and tension to your surroundings and making life harder on yourself and those around you. Take a deep breath, step back, and allow room for flexibility. Letting go doesn't mean losing control. It means trusting the process and making space for peace. Embrace the freedom of a little imperfection. Thanks for tuning in. Don't forget to like, comment, and subscribe for more informative content. See you next time on Healthy Community, Wealthy Community.